Welcome to the Inside Story Hunters podcast. This is Lori with a story. Today's episode is going to be an incredible, inspiring story coming from Nurse Dawn Forhetz, who is part of the amazing, life-changing team at AMG Ketamine and Wellness Center located in Franklin. Nurse Dawn is going to share her inside story and the difficulties and the struggles that she has walked alongside the patients, literally saving their lives, changing lives, and healing people each and every day. And if you've never heard about ketamine, it's such an incredible opportunity for you to potentially help a family member, a loved one, a coworker, someone who's struggling and desperately in search or has given up on believing there's actually a solution for them to rectify the struggles that they're living with chronic pain and so much more. So please take a listen, and thanks for joining us. And be sure to subscribe at LoriWithAStory.com and follow our Inside Story Hunters podcast. Big shout out to our sponsors, C&R Services, for sponsoring this particular episode. Many, many thanks again to Nurse Dawn for joining us today. So hang on, and here we go. And good morning, Insiders. This is Lori with a story. We're here in the AMG Ketamine and Wellness Center on Mallory Lane in Franklin, Tennessee with Nurse Dawn. I'm so honored that you're with me and that you're here to talk to the Insiders on the Inside Story Hunters podcast show. And I feel so blessed. And the fact that you are willing to share your inside story personally in the journey and 35 years more than that of being a nurse and caring for people as if they're your family. I'll say, Nurse Dawn, please tell us your amazing story. I mean, first I want to start with asking you to share about Desert Storm, the military. I mean, look how cute she is.
Yes, ma'am.
Yes, please walk us through your inside story if you would.
I was a nurse for only a year, and it was presented to me to look into the Air Force, and a recruiter was working on me for a few months, and so I started looking at it and seriously felt like, well, maybe this would further my career and learn a lot of things in nursing. So I actually signed up as an officer for 3.5 years. It was a 3-year tour, but then Desert Storm hit, and the president put a stop loss on anyone in the military to be able to get out. So I worked during Desert Storm and was transferred to work the flight line. So anyone coming back from Germany would be sent to our base at Scott Air Force Base, and the nurses would go to the plane on the flight line on a bus, and we would then do all kinds of triage with these patients that came from Germany.
How do you stay calm? How?
Well, you just have a mission in mind, and you're out there to do a job. And I can honestly say the military is very strong in its mission and doing things together cohesively. And when I got out of the military, that was the biggest thing I noticed, that, in just common world jobs, everybody's just doing their own thing, trying to bring home a paycheck, and, and sometimes a lot of selfishness in that. But in the military, everyone works together. And they've got your back. And so I believe military people really do have more of a stronger work ethic. And anyway, I love the military and my experience, but I wanted to start a family and get out and work part-time, so you can't really do that when you're full-time, working 50, sometimes 60 hours a week. So I really still honor our military.
That's beautiful and grateful, and thank you for serving and protecting us and being brave and courageous. Really, when I learned about your story, I thought, oh my goodness, and then you meet her and you're like, oh, she's so sweet, and it just seems so innocent. But take us through now. You've left the military, and in order to raise your own family, And I know there's a part of your story, if you feel comfortable, that I would love for you to elaborate on the journey when you started to work in the NICU unit with babies for many, many years, but still take us through the journey on how the next phase starts to happen and what happened during that time, if you're comfortable.
Sure. Well, we all have a story to tell, and it seems like as we journey through this and meander like a river through life, we find lots of obstacles and a lot of things that bring us to brokenness, and it helps grow us actually as individuals. But I started out in the NICU and then went into the military. Then I missed the baby so much that I went back to the NICU when I got out of the military. It can be very difficult because their veins, of course, are very tiny, and you have to put them in their heads or their feet or their hands. And, working 19, close to 20 years in the NICU, now I can pretty much start an IV on anybody. Have a lot of success stories with little babies and working with families, and so I learned a lot of family connectiveness as well through those years. And I even and I worked at the University of Utah at one point. So I'd moved around the country a little bit because of my husband's job. And so I was out there in Utah, and a family member, a mom of a preemie, just submitted my name to be Nurse of the Year. And it was an incredible honor. And it was because I involve family in their care, and I care for people as if they were my family. Or if someone else was taking care of my family, I would want this to be done for them. So that was quite an honor back in 2002. And so anyway, after doing years and years of babies, I had the opportunity to have a better schedule, get off night shifts, and I went into pediatric surgery. So worked in pre-op PACU, saw a lot at Vanderbilt Children's Hospital, and did that for a while. Then I had the opportunity to work in a surgery center that was closer to home. So I'm always about family. So that work-life balance is important.
Yes.
So, not being on the road, going to Nashville every day to Vanderbilt, made it nice to be able to work in my own backyard. So I did that. And, as God see fit, He had someone contact me out of the blue and said, hey, would you ever consider, since I see that you've worked with IVs and infusions so much, would you consider working at a clinic in Cool Springs, which is my backyard?
And we're talking hospital experience or the setting for years.
Yes.
And then now we're about to enter into a whole nother world, the clinic,
yes.
Right? So I'm sure you're about to go through that, but I have learned by spending time with all of you what a difference that is to be in a hospital environment versus the clinic. So.
Yes. And I should back up just a couple of years because I went to a seminar with Vanderbilt, and someone told me about an assistant management position. And that was my first experience at a rheumatology clinic. And it was completely 180-degree turn working from hospital setting to clinic. It's a different pace, and you're seeing hundreds of patients each day. And I was over the clinical setting as well as the infusion center. So these people were coming in with a lot of pain, autoimmune. Rheumatology is, a lot of arthritis, bone on bone, really serious. People can't even walk. And so we were giving a lot of IV medications, to help with that pain. So as I was there and COVID hit, and it was very stressful and having to wear 4 or 5 hats, and I'm nearing the end of my career, I just kept thinking there's got to be something else that wouldn't be as stressful but yet help people. And so this opportunity came up to me, and I had no idea ketamine could be used in this setting, because I'd worked with ketamine through all my years in surgery.
Because it's a form of...
Yes. I mean, even with pediatric surgery, we would give ketamine for these kids.
It's a form of anesthesia, right?
Absolutely.
So,
yeah.
And it's safe. And
very safe, non-addictive, and to be able to give it to kids for years. It's been around for 70 years that people don't realize.
1970. And really, the veterans are really an area where it's focused now. Maybe not even enough, but to studying and researching to prepare for today. To not embarrass myself and sit with you and to learn as much as I could. I'm overwhelmed by. It's really for everyone.
Yes.
For health and wellness. It doesn't mean you want to take it as a vitamin, but yet there are oral supplements that you can to improve, anti-aging and to help with, sleep disorders and things, rather than reaching out to put us on another medication or 20 medications.
Yeah.
So forgive me. So ketamine.
No, exactly. You're saying all the right things, because ketamine is actually getting people off of pills. It's incredible what it does to reset our brains, and our brains are a lot like a computer. So, if you hit that refresh button on a computer, it just clears out everything, and people are throwing out their pills. It's amazing. I can't even say enough about it. And this is probably the most rewarding job I've ever had in nursing.
And to know that 35 years and saving lives, you're not just a life changer, you save lives. And to be committed, but to also be working for anyone to come visit and be with you, Dawn and Dr. Malco, and just to be in the present, you feel the energy the minute you walk through the door. But, I was introduced to ketamine and to your center as a result of a woman who said to me in a business meeting that her husband for 10 years had been struggling with PTSD, and in a matter of weeks, that he was back to being her husband. She said she lived in an internal hell because he was unhappy and miserable and angry and difficult and isolated and on so many medications. They had no life.
Yes.
And then ketamine, a flyer shows up one Saturday, and she's a woman who helped with the infectious disease center in Vanderbilt. So, this is a professed, incredibly profound professor, and knew enough about ketamine, but so sorry.
Well, I know exactly the couple you're talking about, and that was a very moving story, and he spoke at our open house and at our clinic, and I looked around the room. There was not a dry eye. It was very, very moving, because the thing about it is it's affecting these things in life affect the person, the patient themselves, and their families. And it's destroying people from inside their homes. And during COVID, and then we're having to be so close and seeing the pain that our family members are going through, it affects the entire family.
But let's talk about ketamine, that what it can do for the individual who's going through a trauma, a divorce, a loss, tragedy. And we're deeply depressed and we're disconnected because of hardships and factors that come in our life.
Yes.
Take us through that.
Wow. That was a very dark time for me. And I can talk about it now because I'm on the other side of it, but I could not talk about it before without breaking down or breaking apart or crying at a moment's notice. But
that was a result of divorce, or?
Yes. I was married for 26 years and went through a horrific divorce that not only affected my life, but my kids' lives. And I didn't want that for them at all. And so it pained me more to see them hurting. But in my brokenness and going through all of that, I would be crying and in my home on my couch, just crying out to God, saying there's got to be a way to get through this. And I would get so angry of the injustice and the lies and things that got so twisted and turned that didn't need to happen. It moved me to such a brokenness that I thought, if I ever get through this, I never want anyone to go through this alone like I have. And so
you wanted to help people.
Yes.
You're broken. And you're at your weakest moment?
Yes.
If that's fair to say?
My absolute weakest moment.
I'm going to help people.
Yes. And I said, God, I'm crying out, if I ever get through this and get to the other side of this pain, I want to be able to help people because I'm so passionate about how unjust this world is, that I want to be able to help people in the long run with whatever you want to use me for. And I didn't even know about ketamine then,
but
in this setting.
Did. Well,
yeah.
How different?
I would have been in the chair in a heartbeat.
Because what would happen? Spend a few minutes and take us through the journey. So, Dawn, you come in, you knew about ketamine, you've just gone through it. You're going through a horrific divorce, 26 years of marriage, kids are being impacted.
Yes.
Tell the insiders, because someone could be listening and watching right now, what would happen in that experience when you come into the center?
Well, I didn't get this experience, so it took me years to get over. I mean, probably close to 7, maybe bordering 8 years of torment. If I had known about ketamine back then in this setting, I only knew it for surgery and for pain and things like that, but I did not know it could be given in an infusion clinic. I could have been over this in just a couple of sessions, maybe 3 sessions. I would have been a new person.
And that's in a couple of weeks.
Yes.
So we're talking weeks versus, did you say 7 years?
Almost
8 years?
8 years.
8 years. So we suffer. What does it do to our bodies, our spirits, to the people around us?
I'm surprised I have eyeballs because I cried so hard.
Wow. And you have beautiful eyes.
But as it is, that brokenness grew me, and this fell into my lap, I know, for a reason, and it was probably because of what I went through and how I wanted to help people not ever have to go through that.
That's right.
We're
here today
torture.
This podcast, the point of having the Inside Story Hunters to be blessed to be with you is I would walk along and meet amazing people like you that have this incredible story and have solutions that can help people not suffer, can save lives, change lives, and influence lives, motivate us, inspire us. And often I'd hear these stories and we'd leave it to me to have to tell it. And instead today, we're here, your voice, when I stop talking, is going to be heard to say, are you going through a divorce? Are you living with someone who's PTSD, where there's resistant treatment, depression happening in someone, Parkinson's, Alzheimer's, things that are affected, and all we need to do is reprogram, like you said, jumpstart the computer, restart it, reprogram.
Absolutely. And the thing about it is, everyone's going to hear about these clinics cropping up all over the place because we never knew what it could do.
And you're choosing to be a part of the solutions.
Yes.
No disrespect to the centers that for rehab and so, right? But
absolutely.
Instead of having the person go back to rehab 5 times, let's heal them.
Yes.
And ketamine treatments, when they say, and unfortunately, we may or may not dig into this, and I will with Dr. Malco for sure, but insurance doesn't honor it.
No, it doesn't. And that's because using ketamine in this setting has not been FDA approved. And it will be one day, but unfortunately we can't help everyone like we would want to because of the pocketbook and,
but maybe someone
financial
listening
reasons.
Who's in position financially has a family member or friend, and there will be a way. There's always a way.
We've had some patients actually go through this who have money, and they have given us scholarships, to financially reach out to someone else who couldn't. And so, our hope is one day it won't be an issue with money. We're not doing this for money. We have to have it to be able to function and keep the clinic going, but we're doing this out of passion for helping people, and like my personal story, I don't want anyone to ever feel like they're so bad off that they don't even want to be alive.
That's it. You've saved lives. The testimonials that you'll find on the website are just scratch the surface of walking through the door and to investigate this and just check it out. But all of that to simply say, today you're in the center and you're here. And I say it's the best chapter of your life is what you told me when it comes to your career. Yet so much has been amazing. What else do you think we need to know today?
So many people put on masks and look like they're happy. And I have a smile, I love to smile. And so people think my life is perfect, and we're not. We are not perfect people on this planet, and we're all dealing with something, and we all know someone who could benefit from this. And it's not just for mental illness. So we reach out to people who have pain and have been on opioids for years and years, and it's destroying their lives and their organs, and they're throwing them out after just a couple of treatments. So,
which is like 6 treatments usually in 3 weeks?
Yes, it can be as little as that. We can do 2 or 3 treatments in a week for 2 or 3 weeks, and then we'll do boosters, and it depends on the person because we're all individuals, and so it's based on how much pain you're in and how your body reacts to it. But sometimes people will get treatments every couple of months or once a month, and then after a while they can go longer periods of time. So it's very individualistic. But then we add lidocaine for pain, people who have pain, that gets infused. We have magnesium we do, and also the NAD, which a lot of vitamin centers that are infusing vitamins are using as well. And it's anti-aging, it helps your brain, energy.
Doesn't it also help with insulin deficient, or you're not able to absorb the insulin, which we're talking about diabetes now?
That's
and again,
correct.
I really, when I saw that it could bring benefits to some of the patients for Parkinson and Alzheimer's disease, I thought, how could we not want to encourage this?
Exactly.
Rather than having the families, especially, that have lost their loved ones because mentally they're no longer there.
Yes.
They're physically present, but
Yes.
they're no longer mentally and spiritually there. And if it brought 20% back, why would we not want to do this?
Right. Exactly. And I want to point out the most important thing that goes along with ketamine is propofol, because that is an anesthesia medication that puts you to sleep, and a lot of people know that from Michael Jackson. But we use just enough to make this experience so pleasant and so calming, and it's relaxing. And if you use ketamine without it, there can be some real psychedelic kind of hallucinations that could take you to a dark side. So those two are sort of married to each other. They work so well in making the ketamine more of a beautiful mental. I wouldn't call it hallucinations. It's more of like a travel.
The patients that I've talked to say it's a spiritual journey. It's
Yes.
literally
A lot of
reconnecting
them feel
yourself
that.
to maybe that inner child, that the heart opens again.
Yes.
Their spirit comes alive,
Yes.
right? Because a lot of them have been hardened by or closed off because they're in pain. And what do we do
Yes.
when we're in pain, right? We get into a fetal position. We don't want to move.
We close
become
off.
incapacitated, debilitated, all of it.
Yes.
So you're going through this experience that literally makes you light and free.
Yes.
And I'm repeating words that I've read about and heard about. So, and I can't believe that we didn't really dig into that, Dawn, the fact of you've trained all of the nurses here. You're with your expertise and being certified in order with the IVs and to administer.
Oh, yes.
Right, and controlling this experience. There are centers that provide ketamine treatments, but not the way you all do. So tell us how you're mentoring
Yes.
and influencing.
Well, all of our nurses have worked in an ICU setting, so they have to be ACL certified, be able to know what to do in advanced life support, how to aid in intubation, and we have all the emergency equipment. And not that we foresee that ever happening. We haven't had that happen, but you have that safety in knowing that you've got people who are skilled in that setting, along with an anesthesiologist. So it's always important to have these kind of treatments with a doctor and be able to know how to deal with anesthesia drugs. So all of the nurses have experience in ICU.
I think ketamine is like a superpower.
Oh, we've just scratched the surface.
Right?
There's so much.
But so share some closing remarks as to, again, how do we get to the center? If someone was looking to make a career change, is your team growing? Is that something that, how do they reach you? I know we've mentioned the website again a few times, but
Yes.
How else would you suggest that people learn more about ketamine?
Well, we have a website, and there is a Facebook page as well, and you can read some testimonials. You can Google it. We're out there. It's just Ketamine and Wellness in Cool Springs, and
AMG Ketamine and Wellness Center, right?
Correct.
1909 Mallory Lane in Franklin, Tennessee.
And we're in
Suite
Suite 300. That's right. We're on the third floor. And I want people to know that this is a very safe, peaceful setting. Anything that happens here doesn't go anywhere. And people feel so secure with us because they tell me their life stories, and Dr. Malco as well. And you'll see his heart later. He's got a heart to help people, and that's why I feel so honored to work with him, alongside with him, because he and I have that same passion. That we're not here for a paycheck. And so when you come here, it's a wonderful experience.
Well, you're wonderful. So I mean it. I feel so honored to be with you, Nurse Dawn, and just for all that you do, saving lives, making a difference, and just being a person in difficult times that called out and said, "Let me help someone else." It just demonstrates the selflessness of you, and may your life just continue to be blessed in so many ways. And so, just thank you for the opportunity to share your inside story. But I want to give a big shout out and a thank you to our sponsors, and Tiffany from C&R Services, one of the largest commercial painting companies here in Tennessee, to also benefit groups and Chronicle Partners and Wasco Masonry, and just want to do the honorable mentions of these fabulous companies that are enabling and empowering me to be able to go on site and be here today at the AMG Ketamine and Wellness Center in Franklin, Tennessee.